Okay, congratulations, because if you're seeing this video and hearing my voice, you have actually found it on YouTube. So here we go with the video lecture. Now remember, I'm talking about the the notes starting with I'm on page 5 of the chapter 6 notes, and I'm talking about common disorders of the skeletal system, the last section of the notes. And so first of all, it talks about fractures, and of course, you're familiar with fractures and broken bones and things, and they've classified different types of fractures. Pretty much everything is classified into different categories. Uh, and so a fracture, then, in other words, a broken bone fracture is any break in a bone. They can be partial, or sometimes they call it incomplete, or they can be complete. Um, and the the incomplete fracture of the bone means that the break does not go all the way across the bone, but a complete fracture then is a break that goes all the way across the bone. And closed means that broken bone pieces don't break the skin, and open or compound means that there are broken pieces that break through the skin, which is kind of gross to think about, but anyway. And here you can see kind of interesting. So there's when a bone first breaks. Oh, and by the way, so this break goes all the way across the bone, right? So how would that be categorized then? Is that complete or incomplete or partial or what is it? Well, it would be complete since it goes all the way across the bone, right? Let me get my pointer here. Oh yeah, here it is. The break goes all the way across the bone, so it would be a complete break. It'd probably be closed since I don't think any fragments would be going through the skin, although we can't really see that here. But you can see that a lot of blood, forms, a lot of blood collects uh, around the broken area because the blood vessel has been broken. Um, so there's a fracture hematoma. There's, a lot of blood there. Um, and then you can see that, the epithelial tissue of the blood vessel grows back fairly quickly and closes fairly quickly, and the blood vessel is repaired. And also a lot of capillaries grow into the broken area. So fibrocartilaginous tissue forms first. So that's the fibrous cartilage that we talked about in chapter 4, that we mentioned in chapter 4 on the chapter on tissues. And then spongy bone replaces. So this would basically go along with uh, intramembranous ossification, then probably, uh, uh, as opposed to endochondral ossification. Uh, well, maybe it'd be endochondral too. But and then even after, permanently, there's a permanent area on the healed fracture that looks a little bit different than the surrounding bone. So, for the rest of a person's life, the place where the break happened will show up. It might be kind of subtle, but it will show up on X-ray. Um, so anyway, those are fractures. Let's go on to other disorders. Oh yeah, okay. Oh, sorry. Here's a few pictures. So this would be an open fracture since it breaks the skin, and we've got some really cool X-rays here as well. This one is kind of in a lot of different pieces, but it's not breaking the skin, so it's not really open. Uh, and the book is using some other terms as well that we're not really going to get into. So this is comminuted then. And green stick, so this is a partial fracture since it doesn't go all the way through the bones. And impacted, I think impacted probably means that the bones kind of push together. Um, kind of like when you're in geology class and you talk about tectonic plates that are pushing together and crushing into each other. But anyway, so those are, and a couple more slight breaks as well. Um, and it's kind of tough, it shows up pretty subtly on an X-ray there. Uh, but anyway, so osteoporosis, and you're probably familiar basically with osteoporosis. Uh, this is the next disorder or disease we'll talk about. So a decrease in bone mass, and here you can see normal bone, and here you can see osteoporotic bone, and so you can really see a distinct difference there. So it seems like termites have been eating the this bone here almost, and it's like that commercial, this is your bone, and this is your bone on osteoporosis. Any questions? But so basically, decreased bone mass and increased susceptibility to fractures. Since the bone is so weakened, of course, it's going to be easier to break it, um, and it could the vertebrae could shrink as well, and people become hunched and have bone pain. And the main cause is loss of calcium. So the calcium salts are gone, and so the bones are more like, they're just not as dense. You probably lose some phosphorus salts as well, and maybe some protein too, because boy, this looks like a lot has been lost here. Um, and so uh, estrogen, um, you know, if your estrogen level decreases, then that can cause osteoporosis, because estrogen stimulates the osteoblasts to lay down new bone tissue. So if there's not enough estrogen stimulating those osteoblasts, then they're not going to keep up with the work of the osteoclasts, because the osteoclasts are breaking down bone matrix. And there are a lot of factors that increase the likelihood of developing osteoporosis. And I've got some nice pictures here as well. So your age is a factor. Older people tend to be more susceptible to osteoporosis. Women tend to be more susceptible than men. And Caucasians seem to be more susceptible than other races. And your weight, the thinner people have less adipose tissue, and adipose tissue produces some of the estrogens. Smoking will increase it decreases estrogen levels somehow. So that increases your likelihood, your chances of getting osteoporosis. Calcium and vitamin D deficiency. I don't know if these individuals look like they have calcium and vitamin D deficiency, but it's a nice picture anyway. Lack of exercise. And remember, earlier in the chapter we talked about the fact that the astronauts don't have they don't get as much exercise, and the bones don't have as much of a load on them because of the gravity issue. So lack of exercise, lack of stress on the bones, therefore there's not that stimulus for the bone to keep its matrix built up and strong. Premature menopause, and again, these individuals in the picture don't look like they have to worry about premature menopause, but again, it was a kind of an interesting picture. I just thought I'd add it in there. So those are the risk factors for osteoporosis. Let's look at three other things. Scoliosis, a sideways bending of the spine, and you've got some pictures in your textbook of scoliosis, but there's no pictures in this PowerPoint though that came with the book, which is kind of weird. But you can look at the scoliosis pictures in the book. And then spina bifida. Spina bifida is basically in the embryo stage when the vertebrae are being formed. The vertebrae, the posterior part of the vertebrae, does not form, and so bifid, bi means two, and so bifid means in two parts. So the vertebra does not form all the way around the spinal cord. So there's two parts to it that have not completely closed around the spinal cord. And then now these are I see osteomalacia is kind of out of order here. That should have been before scoliosis, but anyway, in osteomalacia and rickets, it's basically the same disease, but they call it rickets in children and osteomalacia in adults. So the calcium is not able to build up in the bones, and so the bones are not calcified enough. So then they're soft and rubbery because they don't have the hardness that the calcium salts give it. They still have the protein, but the protein is kind of flexible. The collagen protein is kind of flexible. So the bones are flexible. They still have their flexibility, but they're not as hard, and therefore they will bend. And you can see it especially in the legs, since they have to bear a lot of weight, most of the weight of the body. So I got this picture of osteomalacia off the internet, and you can easily see the bending of the bones. So anyway, that ends our discussion of chapter 6. If you have any questions, you can email me or call me or whatever. Thank you for looking at the video.